Yes, hello, greetings everyone. Okay, so today we are going to share about polyarteritis nodosa. Some of these terms, when we find them, they sound hard and it's hard to remember some of these diseases. But with these brief clips, we shall easily remember them faster or fastest and shall easily diagnose our patients if at all they do have them or don't have them, but also can teach others easier when we know them. So polyarteritis nodosa is defined as a multisystem vasculitis that basically is of unknown etiology and basically more commonly affects medium and small sized arteries, just as you know the word arteritis. So it affects the medium and small sized arteries. And it has systemic and ocular features as well. The systemic features basically will depend on which organ is affected. Polyarteritis nodosa can affect the kidney, the heart, the joints, the GI tract, as well as the nervous system. In the kidneys, if polyarteritis nodosa affects the kidneys, you could present with renal failure, you could present with nephritis, you could present with hypertension, you could present with nephrotic syndrome. If polyarteritis nodosa affects the heart, you could present with angina and myocardial infarction. If polyarteritis nodosa affects the GI tract, you could present with bowel infarction. If polyarteritis nodosa affects the joints, you could present with arthralgia and arthritis. If polyarteritis nodosa affects the nervous system, you could present with polyneuropathy or peripheral neuropathy. These are the systemic features, but there is another that at times is left in some books. For example, in Cakewalk, they forgot this in part of their systemic findings, the skin lesions. They are vasculitic lesions on the skin. In Wong, they call these vasculitic lesions on the skin as classic erythematosus hyperkeratotic skin lesions. Those are also found when polyarteritis nodosa affects the skin. We come to the ocular features of polyarteritis nodosa. Polyarteritis nodosa, just as we discussed in Wegener's granulomatosis, we can define and divide and classify the way it affects the eye according to the part of the eye affected, whether it's the orbit, anterior segment, posterior segment, or neurological features. But here, there's not too much of orbital effect, except if you see the eyelids and then you see some of those vasculitic lesions, which are classic erythematous hyperkeratosis on the skin of the eyelid. This could also point towards polyarteritis nodosa. But on the anterior segment, we basically can find episcleritis, scleritis, which is usually necrotizing scleritis. We can find keratitis, which is usually as well peripheral serrative keratitis. But in polyarteritis nodosa, we also have interstitial keratitis. We also have interstitial keratitis. And polyarteritis nodosa is one of the few systemic causes of interstitial keratitis. Then we go to the posterior segment findings, which are basically vasculitis. Vasculitis more affecting the arteries. So you have central retinal artery occlusion features, branch retinal artery occlusion features, cotton wool spots, and don't forget, you could also see features of hypertensive retinopathy. Features of hypertensive retinopathy can also be seen on the posterior segment exam of polyarteritis nodosa. The neurological features that are found in polyarteritis nodosa are basically anterior ischemic optic neuropathy and cranial nerve pulses, which are non-specific. This is also the same as we had about Wegener's granulomatosis. So that's not very specific. The treatment is basically, when they tell you to treat and to manage, you need to first do the investigation. So on investigations, we need to do, we can do the angiography of the renal system, hepatic system, and the mesenteric system. You could find microaneurysms in those mentioned systems. We could also do a biopsy of the skin lesion, and basically we shall find the vasculitic lesions, those on the skin. We will find vasculitis features, which are basically